Hello, I'd like to discuss for a moment second opinions regarding a cancer diagnosis. And the reason I want to discuss this is because I think we are confused about what second opinion really means. When we get a second opinion, we really are looking for perhaps another approach, another perspective on what we've been told is a diagnosis. If one goes to let's say one of the big cancer centers like MD Anderson and gets a specific diagnosis and a treatment plan, etc., and they want a second diagnosis, well, certainly they can go to Dana-Farber or Sloan Kettering or another large institution of the same type. But keep in mind that these people are really practicing from the same guidelines. They were trained pretty much the same, had to pass the same exams, and have the same perspective. So it's sort of like going to two different BMW dealers and asking and looking for the possibility of buying perhaps a Mercedes or buying a Ford or a Chevy. You're probably not going to get that answer. So my recommendation is that if you indeed would like another second opinion from a conventional perspective, then please go to another well-known conventional authority and get their second opinion. But to get a second perspective, to get a different view of perhaps what cancer is, really, how did it come about, and what are the necessary steps to eliminate it? And for example, the questions might be asked, is there anything I should do about changing my diet? And you'll find that most institutions, conventional institutions, don't think that diet is really important, and they pretty much tell people to eat whatever they can. They might mention nowadays, because it's becoming popular, to lower your sweets and your sugar. But on the other hand, in the chemo wards, where they're delivering and administering a chemotherapy, you'll see that there are bowls of candy and cake. So anyway, that you're not going to get that, but you might want to ask: is there certain things? And you won't get those answers from the conventional world. They are more interested in combating the tumor or tumors, and they are aware that their therapies are dangerous, and so they are doing a lot of research on targeting cancer, such as with monoclonal antibodies, etc. However, they don't really offer much in terms of how one can go about changing their body's biochemistry so that it will no longer be a hospitable host to cancer. Nor do they really look at how the body can be naturally stimulated so that its immune system is working at top notch. So, really, a second opinion means going to the Mercedes dealer, going to the Chevy dealer, and asking them. Okay, so you need to, perhaps if you want, get two conventional opinions and then get two truly alternative opinions or integrative cancer specialists. Now make sure that the true second opinion you get is from an integrative oncologist, an alternative physician who has several years' experience and is quite knowledgeable. And you can ask questions of them, but you'll find that most of them are doing pretty much the similar types of interventional modalities to target the cancer. And these are all biochemically sound and well documented in science. And they include high-dose vitamin C, ozone, artesunate, B17, etc. There's a lot of targeting ways that absolutely do no harm to the body. And then there, of course, is IPT, which does minimal damage, but is not a big deal, really. Can be dealt with quite easily. So there's no hair loss or anything like that. So in addition to asking them about whether or not what modalities they use, you need to ask them, how can I go about changing my life so that this doesn't happen again? And are there any things that you can do for me to help me uh, fight my addiction to eating and the lifestyle I have? And is there anything you can do to help me enhance my immune system that you can do specifically for me and that I can do specifically for myself? So these would be the questions to ask a truly alternative physician, but please make sure that they are duly qualified and experienced.